Momentous day for a lot of parents, including Erica and I out here. So
Yes.
Let's cover some of what we know about this smaller dose. Are there fewer side effects? Does it have the same protection? And any reason maybe if your kid's about to turn 12, should you wait and have them get the larger dose?
Yeah, so great questions. What we know so far is that the data that was presented again today suggests that the lower dose is effective and safe in the younger age group. So I would stick with the age of your child at the time the dose is due. And this is really, really a good day for us.
Okay, well, Dr. Boucher, there are a lot of parents still undecided about vaccinating younger kids, especially healthy ones. So what do you want them to know?
Well, I think it's important for parents to know that every step was followed in the development of this vaccine for children, right? So external monitoring of the studies themselves, enlargement of the studies to pay attention to potential side effects like that myocarditis that we've talked about before, then external review by the FDA after their thorough review, and then today, external review of the CDC after their thorough review. So every step has been followed, and we have very good evidence that this vaccine is safe in children. And we know that COVID is not safe in children, and that indeed some children have become quite ill and even died from COVID. So the belief and the data today support the benefit outweighing the risks of this vaccine in our healthy young children.
So we have asked you many times, you've done it here at 545 a number of times, to debunk the myth that COVID vaccines can somehow cause future fertility problems for children. Other experts have done the same thing many times here and across the country. So are you surprised that so many parents in the U.S. still cite possible infertility as their kind of biggest hesitation about giving these vaccines to their children?
Yeah, I'm not surprised. I'm sad because we know this is misinformation, and part of the work that many of us in infectious disease and public health are doing is trying to provide good, credible scientific information. There is no evidence that the vaccines have any impact on fertility. In fact, that was complete misinformation. And so I want to just reassure moms and dads out there that that is not a concern with these vaccines, and that you can be very confident in the safety of them for your children.
An important message. And so as a healthcare worker as well, you were among the first in the state to become fully vaccinated against COVID-19. We learned today you just received your booster dose. So what can you tell us about your decision? Any side effects? How are you feeling?
Well, my decision was really made based on the guidance that frontline workers, healthcare workers like myself, should consider getting a booster. So I received one a couple of weeks ago, and very similar to when I had the second dose, I felt a little crummy the second day, a little achy and a little sleepy, so I took a nap. And other than that, I was back to normal completely within a day.
All right, Dr. Helen Boucher, thank you so much for your time on such an important day. Get those kids vaccinated for them, their parents, and their grandparents this holiday season.
Thank you, Dr. Boucher.
Thank you. Good to see you.